I'm Dr. Susie Gronski, Doctor of Physical Therapy, Pelvic Health Therapist, and Sex Counselor. In this video, I'm guiding you through a step-by-step exercise routine to help treat urinary leakage after prostate surgery. While this is geared towards folks recovering from prostate cancer surgery, if you're dealing with incontinence for other reasons, these exercises can still benefit you too. Urinary incontinence after a radical prostatectomy is a common experience for many men. Right after the catheter comes out, up to 90% of men have some urinary leakage. This is normal and expected. Your body is going through a big transition and healing process. Over time, the numbers change. About a year out from surgery, incontinence rates can range from anywhere from 5% to over 50%, depending on the individual and their unique circumstances. So what is a radical prostatectomy? Well, it's a surgical treatment for prostate cancer where the entire prostate gland and seminal vesicles are removed. Some research shows that robotic-assisted radical prostatectomy, which is done through small incisions in the abdomen, might lead to lower rates of incontinence when compared to open surgery, which involves a larger abdominal incision. But the jury's still out on this one regarding specific techniques. There are a few factors that can increase your risk of developing urinary incontinence after prostate removal. These include things like a history of transurethral resection of the prostate, or TURP, existing issues with bladder muscle control, such as overactive bladder or neurological conditions, prior radiation therapy, surgical injury to nerves or blood vessels, injury or damage to the bladder neck, and internal urethral sphincter during surgery, higher age, more complex tumor growth, and even a surgeon's experience can all influence continence recovery outcomes. Here's the good news. Many men do regain bladder control with time, even without doing anything. But pelvic floor muscle training has been shown to be more effective than doing nothing, especially when it comes to rebuilding your bladder confidence and control. Once the catheter is out, usually about a week post-op, you can begin pelvic floor muscle training. At first, you'll probably notice that holding in your pee feels tough. That's normal. Things tend to get better. Nighttime bladder control is often the first to improve because the bladder is less active when you're sleeping and you're not eating or drinking. The more frustrating leaks usually happen with activity like coughing, bending, exercising, or just moving around. That's called stress urinary incontinence because leakage happens under physical stress or pressure. Before diving into dynamic movement-based pelvic floor work, it's important to start with the basics, learning how to isolate and engage your pelvic floor muscles properly. Want a step-by-step exercise routine to help you stay dry and get you back to doing what you love? Join me on Patreon for guided progressive workouts designed to stop bladder leaks and support your sexual recovery after prostate cancer treatment.